Stop looking at your stomach. Start looking in the mirror, because your eyes may already be showing you exactly what is going wrong inside your colon, right now, before you feel a single symptom in your abdomen. The University of Illinois College of Medicine states clearly that systemic diseases often show up in the eyes before physical symptoms appear anywhere else in the body. And gastroenterologist Dr. Tauseef Ali, Medical Executive Director of SSM Health Digestive Institute, has documented that up to 10% of patients with inflammatory bowel disease develop visible eye changes directly tied to what is happening in their colon. In the next 10 minutes, I am going to show you 4 specific color changes in your eyes that are recognized warning signals of colon danger. What each one looks like, what it means, and the one mirror test you can do right now that could be the most important thing you do for your colon health today. Before we go any further, drop a comment right now with just one word. When you look in the mirror, do the whites of your eyes look completely white, or do they look slightly off? Type white or off right now. And if you have had any digestive issues in the last 6 months, bloating, irregular bowel movements, unexplained cramping, add the word gut to your comment. You will understand exactly why that matters in about 3 minutes. Picture this: a 63-year-old woman goes to her eye doctor for a routine checkup. No stomach pain, no alarming symptoms. But when the doctor examines the back of her eyes, he pauses and asks, "When did you last have a colonoscopy?" She came in for her glasses prescription. But the doctor had spotted dark pigmented lesions at the back of her eye, a pattern specifically associated with a genetic condition that dramatically increases colorectal cancer risk. That eye exam led directly to a colonoscopy. The colonoscopy found early-stage polyps that were removed before they progressed. Her eyes saved her colon. That connection between what appears in your eyes and what is happening in your digestive system is one of the most underused diagnostic opportunities in modern medicine. Here is what most people have never been told. Your eyes and your gut are connected through your immune system, your liver, your blood chemistry, and your genetics. When something goes wrong in your colon, inflammation, bile backup, fat malabsorption, or genetic cellular changes, your body communicates that distress in ways that show up visibly in your eyes. The National Institutes of Health, the American Cancer Society, and major gastroenterology centers have all documented specific eye findings that correlate with colon disease. These are not vague associations. They are specific, observable, color-based changes. And I am going to walk you through all 4 right now. Color warning 1. Yellow in the whites of your eyes. If the white part of your eye, called the sclera, has a yellow tint, that is called scleral icterus. It signals that your liver is struggling to process a substance called bilirubin. Here is why that matters for your colon. Bilirubin is a yellow pigment your body produces when red blood cells break down. Normally, your liver processes it, and it flows out through your bile ducts into your digestive system. But when something is blocking that pathway, a tumor, a mass, or severe colon backup creating pressure on the bile duct system, bilirubin backs up into your bloodstream. Because the white of your eye has a very high affinity for bilirubin, the yellowing appears there first. Stat Pearls at the National Center for Biotechnology Information confirms that yellow eyes are detectable when bilirubin reaches just 3 milligrams per deciliter, a level reached before any abdominal pain begins. Researchers at Ohio State University Wexner Medical Center reviewed 2,328 colorectal cancer patients and found that jaundice occurred where tumors created bile duct obstruction. Specialists at New York Presbyterian and Weill Cornell Medical Center confirm that yellow eyes are a hallmark symptom of obstructive processes in the digestive system. The self-check. In natural daylight, look at the whites of your eyes. If there is any yellow tint, especially combined with pale stools or dark urine, contact your doctor that same day. Color warning 2. A white or gray ring forming around the edge of your colored iris. This is called arcus senilis. It looks like a pale arc or full ring at the outer edge of your iris and is caused by lipid deposits, cholesterol, triglycerides, and low-density lipoproteins, leaking from blood vessels and accumulating in the corneal tissue. Stat Pearls at the NIH documents this directly. The colon connection is this. A high-fat, low-fiber diet drives both elevated lipid levels and colon inflammation. The American Cancer Society identifies a high-fat, low-fiber diet as a major risk factor for colorectal cancer. When fat is not being properly metabolized, it slows bowel transit time, alters the gut microbiome, promotes chronic colon inflammation, and over time creates conditions for polyp formation. The white ring in your eye is visible evidence that your fat metabolism is significantly dysregulated. Cleveland Clinic documents that in people under 40, this ring warrants immediate investigation. Even in people over 50, a ring appearing in only one eye is a signal demanding evaluation. The self-check. Look closely at the outer edge of your colored iris in bright light. If you see a white, gray, or bluish arc or ring, especially under age 50, schedule a lipid panel and digestive health evaluation. Color warning 3. Persistent red patterns in the whites of your eyes. Not allergy redness. Not one bad night of sleep. I am talking about red, inflamed areas in the sclera that keep coming back week after week without a clear external cause. This is called episcleritis, and it is a recognized extraintestinal sign of inflammatory bowel disease and colitis. Dr. Tauseef Ali explains it directly. The more severe the inflammation in the gut, the more severe the eye inflammation will be. They are responding to the same systemic inflammatory process. The Global Healthy Living Foundation reports that 1 in 10 people with inflammatory bowel disease will develop eye complications, and episcleritis is the most common of those. Envision Eye Centers, reviewing the published literature in December 2024, explains that the shared immune pathway between gut and eye means when the immune system attacks the colon lining, it simultaneously triggers inflammatory responses in the eye. The self-check. If you have persistent eye redness lasting more than a week without a clear reason, and you have any digestive symptoms like cramping, urgency, or irregular bowel habits, tell your doctor about both together. That combination is exactly the pattern gastroenterologists look for when assessing inflammatory bowel disease. Color warning 4. Dark brown or black pigmented spots at the back of the eye. This is the most direct color warning connected to colon cancer risk, and the one most people have never heard of. When an eye doctor examines your retina through dilated eyes, they look for dark pigmented spots called CRPE, congenital hypertrophy of the retinal pigment epithelium. When multiple dark spots are present in a specific pattern, this is a recognized indicator of Gardner syndrome, a genetic condition that carries near certain risk of developing colorectal cancer if left unmonitored. The National Institutes of Health lists CRPE as a specific manifestation of Gardner syndrome. A research review in Science Direct confirmed the direct link between retinal pigmentation patterns and hereditary colorectal cancer risk. And a case published in Clinical Case Reports in Wiley Online Library documented a patient whose eye exam was the first warning that led to a colon cancer diagnosis. RVC Optometric Associates states that when eye doctors detect multiple dark, pigmented lesions in the retina, asking about the patient's last colonoscopy is the immediate next step. The self-check. You cannot see CHRPE in a bathroom mirror. It requires a dilated eye exam. If you have a family history of colon cancer or polyps, and you have not had a dilated eye exam recently, schedule one now and tell your eye doctor specifically about that family history. Now here is the mirror test. Go to a bathroom with good, bright lighting. Look directly at your eyes and check each of these 4 things one at a time. 1. Are the whites truly white or do they have any yellow tint? 2. Is there a white, gray, or blue arc forming around the outer edge of your colored iris? 3. Is there persistent redness that has been there for more than a week without a clear reason? 4. Do you have a family history of colon disease that means you need to book a dilated eye exam? Write down what you notice. Bring it to your next appointment. And use specific language when you describe it. Scleral yellowing, white ring around the iris, persistent episcleral redness. That language tells your doctor exactly what to look for. Here is what you now know. Yellow eyes signal bilirubin backup. linked to bile duct obstruction from colorectal tumors documented at Ohio State University and Weill Cornell. A white ring around the iris signals lipid dysregulation, driven by the same dietary environment the American Cancer Society links to colorectal cancer risk. Persistent red patterns in the whites of your eyes signal gut-driven immune inflammation, documented by Dr. Tauseef Ali and the Global Healthy Living Foundation as occurring in 1 in 10 IBD patients. And dark retinal spots signal Gardner syndrome, a hereditary polyp condition confirmed by the NIH and peer-reviewed gastroenterology research as a direct colon cancer precursor. 4 colors, 4 warnings, 1 mirror. If this opened your eyes, drop the word "seen" in the comments right now. And please share this with someone who has a family history of colon disease or who has been putting off their colonoscopy. That share could genuinely matter more than you know. Subscribe to this channel because this is exactly what I do here. I connect research sitting in medical journals to information you can actually use. This video is for educational purposes only and is not medical advice. If you notice yellow eyes, persistent eye pain, or sudden vision changes, seek same-day medical evaluation. Never delay professional care based on anything in this video.